students. Today I'm going to be making a wonderful fun video for you on an OB initial assessment. So when you do yours, remember that you need to have your charting flow sheet to fill out. Today I will be performing the assessment so that you will have an idea of how to follow along for your own assessment. All right, so of course I'm going to start with hand hygiene. Hello, Victoria. My name is Rani Gibbs. I'm going to be your nurse today in triage.
Hi.
Hi, I just want to make sure I have the right patient first, okay? Let me look.
Yeah.
Okay, what is your birthday?
December 31, 1979.
Okay, and what's your name, your first and last name?
Victoria Pradhananga.
Can you please spell your last name for me, please?
Sure. Pradhananga.
Wow, all right. Let me check your name band and make sure that that is.
Sure.
Well, good, everything looks correct. Okay, let's get started then. Do you have any allergies?
No, I don't think so.
Okay. And how are you doing today? How are you feeling? What brought you in?
Oh, I feel like the baby is coming. My
Oh,
stomach feels really tight.
does it? Okay. Are you having any pain?
Yes, it hurts.
Does
Every
it?
time it contracts.
Where does it hurt?
Like my belly.
Your belly? Okay. And how bad is the pain?
Like every time it happens, maybe 6 out of 10.
Okay, 6 out of 10. Okay. So what I would like to do, tell me again, how about any discharge? Are you having any change in vaginal discharge?
Yeah, it seemed like there was it feels different, but I couldn't really see.
Okay, do you feel like your panties are getting wet or anything
Yeah.
like that? All right. When did that start about?
Like yesterday,
Oh, yesterday. About what time?
like midnight.
Okay. All right. Well, we'll look into that too then. Wow. All right. So, what I'd like to do is go ahead and put the monitors on you. And we have monitors for checking the baby's heart rate. Are you okay if I do that now?
Yeah, sure.
Okay. Can I pull this blanket down?
Yeah,
Sure.
sure.
Expose your belly.
That's okay.
Oh, your beautiful belly. Look at that. Okay. So I have two monitors here today. I have a monitor that is for the baby's heart rate. And the one for the heart rate is flat. If you're going to put it on the lower part of your belly, I need to use some gel for this one. All right. And I plug it in. The gray end goes into the gray plug, the first gray plug. All right. And then I have some belts here. I'm going to lift the belt up and find the heart rate. Let me see. Do I hear it there? Boom, 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 boom. That sounds like mom. Hear it here. Boom, 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 boom. Okay, that sounds like baby there. So you go ahead and there's a little knob that I put this on with. Put that on. Okay, and lack of knob, I'll just tie this one. Is that too tight?
No.
Okay. Good, so far baby sounds good, that's great. Okay, and then the second one is for contractions, and what it is, Victoria, is it's just a little spring here. When you have a contraction, I don't know if you've noticed, but your belly gets hard and it compresses the spring. We do, because it's a spring, we do not want to use any gel on this one, or it will kind of muck up the spring itself, and that won't work well. The end of it is white, and it will go in the white connection there. And I now need to find the top of the fundus. Oh, I see something hard there, the top of the fundus. Feel it, I mean, and I will put this on as well, with this little knob through the little hole. Okay. Is that comfortable? Too tight?
No, no, it's perfect.
Okay, great. All right, so I'm going to go ahead and see how your baby's doing. Oh, what's the baseline? Oh, I see that. I can see what the baseline is. And accels. I'm checking for variability and any decels. All right, well, it looks like you have a category 2 tracing. So we'll get some IV fluids going on you. That might help with that and make it a little better. I need to just take a moment and look at your prenatal results, okay? I'm gonna just look in here. All right, okay, I see you're 39 weeks. And your labs, you're missing one lab, and that's for the hepatitis B. So I'm gonna go ahead and order that for the lab to come and draw that for you. Everything else looks good. Okay, so have you been feeling the baby move today?
Yeah,
Quite a bit of
Quite a
movement,
bit.
normal?
Yeah.
All right. And I'm going to go ahead and just do some vital signs on you and then check your cervix. That means I'm going to check your vagina. And yeah, sorry about that. Not
Okay.
fun, but I'll walk you through it. And anything you don't want me to do, just say stop and I will stop, okay?
Do you have to do it?
Well, that's the way that we tell if you're really in labor or not, is if there's any
Okay.
change to your cervix, because it's gonna open up the closer you get to pushing the baby out,
Okay.
okay? So, for your vital signs for the blood pressure cuff, this also goes in the monitor. And then to take your oxygenation of your blood and your pulse, this goes in the monitor too. And I'm gonna put this on your finger. There we go. Okay, I'm gonna remove the sheets from down here. Oh, wait, before I do that, it'd be good for me to see what position the baby's in. So let me do that check. Let me take this off. All the Leopolds, Dr. Leopold, I think, came up with this. This won't be uncomfortable. I need to put a little pressure on your belly. If it does become uncomfortable, let me know and I will stop.
Okay.
Okay. And let's see, the first thing, feel down here. Okay, and feel, okay, I see. Okay. So that's good. Everything looks good so far.
Oh,
I'm gonna
okay.
do the vaginal check now and check your cervix. So I'll be putting my hands, my 2 fingers up inside of your vagina. All right, do you agree to that?
Okay. Yeah,
Okay,
I
I'll go
agree.
very slowly and just say stop. If you ever need me to stop, I would be happy to do that.
Okay.
I'm gonna pull the blanket down now. Okay? All right. Oh, I see you are a little wet down there. Okay, we'll be doing a little test for that. What color and was your panties?
I
Wait,
think it was little light pink, maybe.
Okay, all right. So let me put some gel, some lubricant on my fingers and my sterile gloves. And I'm going to put your head back a little bit. Okay, are you ready for me to touch you down there?
Yeah.
Okay, real slow. You okay?
Yeah.
Yeah, I feel your cervix. All right. Okay. Well, very good. You're doing very good for how dilated you are. That's great. Oh,
I
sorry
feel it.
about that. Yeah. Let me see how strong that contraction is.
Ooh, right there.
Yeah. Okay. Maybe moderate. Yeah, they're going to, your uterus gets hard every time you have a contraction, and they're going to get as strong, as hard as what we call firm, which is the same as your forehead feels. Yeah, yeah. Okay, so I'm now going to just check that fluid and put it on a little slide to see if that is amniotic fluid. That means if your bag ruptured, okay? Okay. I am writing down in my flow sheet the fetal station, the presenting part, and position, and the dilation, and of course effacement. Tell me, what were you planning to do for your pain today? Do you have a labor birth plan?
No,
No? What's your idea of it? Are you open to having an epidural? Were you thinking of using pain medication or just positions and
I think
relaxation?
anything that helps.
Anything that helps?
Mhm.
Okay, well, I'd definitely be glad to help you with that. And we can start with some position change and maybe some heat to help you with this level of contractions. Would you like to do that?
Yes, that would be great.
Okay, I'm gonna call the doctor now and get some orders and see if at this point he wants you to go ahead and be moved to a labor room. All right, I'll be right
Okay.
back.
Sounds good. Thank you.
Mhm.